anteriorly, posteriorly, and after I have to understand which area is more in dysfunction and which area is less in dysfunction. You're making the movie, correct? Okay. So let's start from behind here. I'm gonna say out because then you just see my hands moving. So I'm on the Indian, so I'm gonna search the Indian on the right. So Indian, 2, 1, 2, 1, lateral C1, AC1, AC1, rare. So we did the upper ones. We go down here, we do 2, 3, 4, 5, 6, 7, and 8. 2, 3, 4, 5, 6, 7, and 8. 2, 2, 3, 3, 4, 5, 6, 7, 8, and the other 8 here. And again 2, 3, 4, 5, 6, 7, and 8, and the other 8 here. And I can work my way up like so, or I can just turn around this way. I have an idea already what you have in the neck, and I'm going to search down on the thoracic area. So I'm going to do my 1 here, my 3 here, my 2 here, 6, 5, and 4. And then I go here. 7 here, 7, 7, 7, 9, 9, 8, 8, 10, 10, 11, 12, AL1, 5, 2, 3, 4, iliacus, I throw in even up psoas, lisi, inguinal, and I search here for my hypho. Okay, so I have an idea of what she has here, and then from here we have our 11, 12, AL1, AL5, lisi, 2, 3, 4, iliacus, inguinal, and gently here I just for my lethal. Okay, so before I turn her, I just can tell you that she's worst on her neck, more anteriorly than posteriorly, and on her upper neck she's worst on the back part and anteriorly. Here she has some points more on the right than on the left, even though she has an inguinal here is quite hot, but especially here the 2s, the 3s, she didn't like absolutely these points here, okay? And something on the iliacus wasn't very, very nice. So from this evaluation I can tell you that this is the major area of dysfunction for now, and then there's something here and a point here. Well, she had something here on the 4 maybe that you disliked a little bit, 4 or 5 that she disliked a little, okay? So now I ask her to turn around, and I'm going to check the posterior part. It's always a good idea that she has the face down on the hole, but anyway. So we're going to search. I just bring this a little bit up, okay? Just not so much, just like this is fine. So I'm going to search here at this for 1, 2, 3, 4, and go up, okay? And then I go here like this. Okay, she has something here and she has even something there, so this she dislikes this, and something here she doesn't like a lot. And again here, you see I don't press too much, I just press a little bit. And when I feel that there is some point that maybe she doesn't like, I just press more because I feel the tender points down there. And then I go down, 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 and I walk my way until here, like this, until here. For my second line, I just do the drag. Just do the drag like this. And even here, she dislikes this point here. And I can do the drag for the third line. I can do the drag. Oh, there's something here that she doesn't like on this transverse process too. Okay, so she has a bunch of thing on the left and a bunch of thing on the left even here. Let me work my way down. Could you lift a little bit the table? Okay, thanks. And for the lower part, here's our ilium. So we have our 4, we have our 5, which we have checked already. And so we have our upper pole 5, hissi, 4, 3, gluteus medius, upper pole was here, lower pole and the other point here, hypho here, okay, sacrum 1, sacrum 5, 2, 3, 4, piriformis, PLT. Okay, and then there are other points that we usually don't search at first. Upper pole 5 here, hissi here, a 4 here, a 3 here, a gluteus medius here, check your gluteus medius here. Your upper pole, your hypho, your piriformis, your S1, your S5, and I've traced this already. So she's quite okay. She has something on the left here. Okay? She has something on the left here. She has something on the sacrum neuron 1. Sacrum 1 she doesn't like a lot. A little bit of a piriformis down there she doesn't like a lot. And a small 4 still up around this area here she doesn't like. So on the back part she's in dysfunction to the right. Well, even anteriorly she was in dysfunction to the right.
That's the left.
Oh, this is the left one?
Yeah.
So anteriorly she was more dysfunction on the right here and posteriorly on the left, which could be a compensation. Okay, could be a compensation. But her worst area it's always the neck. So on her, my putting in all you know about the information I gave you, meaning, you can turn around, Corinne, if you want. So now we have evaluated the patient, but before this she had told to us her complaint. So she came in for which problem? Maybe she came in for lumbar pain, or she came in maybe for cervical pain. So she came in telling us what her complaint was. We had to watch her activity-wise. So she could bend, or she could flex, or she couldn't extend, or so on. What kind of posture the patient has. If the pain is deep, diffuse, or if it's localized and precise. All of this information and then your evaluation will start to make you understand what is the priority. On her, without knowing anything, her neck is the worst area, and then this pelvic here. But see, she has something here and something on the back on the thoracic region too, you remember? The neck, and you know the neck and the lumbars work together, but that was a highest accumulation of point. I expect that maybe the anterior or lumbar region will have already less points. And so probably I would do maybe 1 point here, couple of points there, at least 2 points there, 1 point in the back and 1 point in the back too. This comes up to 2, 1, 5, 6 to 7 points in one treatment. And if you think at 1 point you do it in like 90 seconds, so it's going to take you 15 or 20 minutes to do your work and a couple of minutes for your evaluation.